Hello friends, welcome to Tutelage, the career guru for nurses. In this video, we will be discussing some of the most important image-based questions for the upcoming AIIMS NORCET 2020. First question, what is the finding in the image? Here you can see 4 pictures in the screen. Answer what is shown in the image. It is known as butterfly rash. Butterfly rash is seen in patients with SLE. SLE means systemic lupus erythematosus. SLE is an autoimmune disease. In this disease, the immune system of the body attacks healthy tissues. It can affect the skin, joints, kidneys, brain, and other organs. Butterfly rash, also called malar rash, and it is present in approximately 46 to 65% of people with lupus. It has the shape of a butterfly, that's why it is called butterfly rash, and involves the bridge of the nose, and it is characteristically red or purplish and mildly scaly. Second question, what is the disease condition in the image? Here you can see 4 images of a person's chest. So in that image you can see a depression in the sternal part. What is the name of the condition? The condition is called Pectus excavatum. Pectus excavatum is a congenital deformity of the chest wall that causes several ribs and the breastbone, that is sternum, to grow in an inward direction to form a depression in the chest. Third question, identify the condition. Here you can see a projection on the chest. So what is the name of that condition? This condition is called Pectus carinatum, otherwise called pigeon chest. Pectus carinatum, also called pigeon chest, is a malformation of the chest characterized by a protrusion of the sternum and the ribs. Fourth question, what is the finding from the below images? In the images you can see the lower limbs of children. So what is the abnormal finding seen in the image? The condition is called Genu valgum or nog knee. It is a condition in which the knees angle in and touches each other when the legs are straightened. It is often corrected naturally as children grow. When it is caused by the disease such as rickets, it may continue or worsen with age and it won't get corrected naturally. So here you have to notice the finding that the knees angle in and touches each other. Fifth question, what is the finding from the below images? The images shows lower limb abnormality of children. So you should tell what is the abnormal finding from these images. The abnormal finding is Genu varum or bow legs. Genu varum is marked by outward bowing at the knee. Lower leg is angled inward medially in relation to thigh's axis, giving the limb overall the appearance of an archer's bow. Nutritional rickets is an important cause of childhood Genu varum. From the images, you should understand that the lower legs angled inward medially in relation to the thigh's angle. So it gives the appearance of a bow, that is known as bow legs or Genu varum. Sixth question, what is the finding from the below images? Here you can see 4 X-ray images and you should tell what is the observed finding. The image shows Greenstick fracture. Greenstick fractures are stable fractures and a part of the bone remains intact and unbroken. that you can see from the X-rays. Greenstick fractures occur most often during infancy and childhood when the bones are soft. 7th question. What is the device shown in the below image? Two images you can see. In that, a person's legs are kept apart using that device. What is that? Name of the device is a hip abduction pillow. A hip abduction pillow is a device used to prevent your hips from moving out of the joint. The pillow is placed between your thighs and attached to your legs with straps. So, it prevents your hips from moving out of the joint. 8th question. What is the surgical procedure performed in the below image? The correct answer is laminectomy. A laminectomy is a surgical procedure that removes a portion of the vertebral bone called the lamina. Here you can see the parts of the bone, and in the second image that part is removed. The entire lamina is removed. So the procedure is known as laminectomy. 9th question. Which is the instrument shown in the below image? There you can see a surgical instrument used for a procedure. What is the name of the instrument? The name of the instrument is Beckman Retractor. Beckman Retractor has hinged arms with pronged tips that are used to hold back muscle and tissues. The arms move both backwards and forwards, and the prongs may be blunt or sharp. It is mainly used for retracting the muscles or tissues. 10th question. What does the CT finding shows? Here you can see an image from a patient's CT, and by seeing the image, what you can interpret? The CT image shows enlarged lateral ventricles. The ventricles of the brain are a communicating network of cavities filled with cerebrospinal fluid or CSF and located within the brain parenchyma. The ventricular system is composed of two lateral ventricles, the third ventricle, the cerebral aqueduct, and the fourth ventricle. In the top image, you can see there is a large space for the ventricle, that is enlarged lateral ventricle, and the normal size lateral ventricle is shown in the below image. 11th question. The below shown image represents which procedure? In the image shown, you can see a coil is filled in a cavity. So, what is the name of the procedure? And the coil is inserted through blood vessel. It is endovascular coiling. Endovascular coiling is a procedure performed to block blood flow into an aneurysm. Aneurysm means a weakened area in the wall of the artery. So dilation happens, and that is known as aneurysm. So we insert coils through the blood vessels and fill the aneurysm, and the procedure is known as endovascular coiling. Thank you for watching the video. Subscribe our channel for the latest updates and enable the bell icon. Happy learning with tutelage, the career guru for nurses.